we get terrible healthcare for women, and, like, we're, like, in the Stone Ages on a lot of things, and anyway,
You
so
are,
I'm
but
s
I know you're not alone in that it's not like it's so much better in the States.
it's not.
It's just it's a very tightly controlled narrative, and it's a seldom few that even looks outside of the narrative, let alone believes outside of the narrative and acts outside of the narrative and has faith outside of the narrative. So we are still very much the minority in the group of us who I call the truth seekers. Right? Like, we're still very much the minority, and we still have the minority of a following. Now, am I going to change that? Hells yeah.
Yes, you are. Yes, you are. And that's part of the reason why you're here today. So, Dr. Jenn Simmons is our guest today on the Pleasure Principles podcast. And welcome, Jenn.
Thank you.
Tell us who you are, what you do, and we'll
Yeah.
get into your soapboxes in a minute.
Okay. Yeah. Excited for another opportunity to stand on my soapboxes.
Everyone
who am
listening
I-
loves it.
Who am I and what do I do? What a philosophical question. I mean, in a totally reductionist way, I am a breast cancer surgeon turned functional medicine physician and integrative oncologist on a mission to forever change how we diagnose, how we treat, how we reverse, and how we screen for breast cancer. I mean, I guess, from a professional standpoint, that's who I am. I'm also a wife and a mother and a friend and an athlete and a philanthropist and, all of those things, an author. But the why I do what I do is probably the most interesting part. And people ask all the time, how did you find breast cancer? I didn't find breast cancer. Breast cancer very much found
Mm.
And I actually don't remember a time in my life where I didn't know about breast cancer. It was part of the thread, the tapestry of my family. I come from a very big family, and all of the women in my family get breast cancer, with the exception of my mother, who got colon cancer. So as a child growing up, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. So I'm going to totally date myself, and this may or may not resonate with you and your listeners in any way, because your listeners, I think, are a little younger than I am. But my cousin Linda was beautiful, brilliant, larger than life, the queen of Motown sound in Philadelphia, and she was my hero. So she wrote 54 hits in all, and her most famous song was The Greatest Love of All. So she wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. But it really received its acclaim in March of 1986 when Whitney Houston would release that song to the world. And at that time, it would spend 14 weeks at the top of the charts. Only my cousin Linda would never know, because Linda died of metastatic breast cancer just 1 month after Whitney released that song.
Ugh.
I was 16 years old and my hero died. And her life and ultimately her death gave birth to my life's purpose, because I never wanted another woman, another family, another community to have to suffer the way that mine suffered. And so I did the only thing I knew how to do. I became a doctor, the first doctor in my family. I became a surgeon. I became the first fellowship trained breast surgeon in Philadelphia. I became the first onco-plastic surgeon in Pennsylvania. And I did that really well and for a really long time. And I did it long enough for my aunt to be diagnosed and long enough for my mother to be diagnosed. And with all the writings on the walls, I'm about 15 years into my career, and I'm arguably at the top of my career. And I go from probably being one of the most high functioning people that you've ever met in your life to I can't walk across the room because I don't have the breath in my body in what seems like a day. And so I have this really intense 3-day workup, at the end of which I find myself sitting in the office of my friend and colleague and physician. And he tells me that I need surgery and chemo and radiation, and I'm going to be on lifelong medication. And despite the fact that these are words that I say all day, every day without hesitation or reservation, there is a big difference between saying those words as a doctor and hearing those
Yeah,
words
receiving
as a
them as the
patient.
patient.
And though I knew that what he was telling me was his version of truth, and though I knew that those were things that I said all day, every day, somehow I could not receive them. And you can call it God, you can call it universe, you can call it whatever you want to call it. I could not quiet this voice in my head that said there's something more, go find it. Now, please know, I am a very conventionally trained physician. I went to one of the finest medical schools in this country. I went through medical residency and fellowship, and I am conventional all down the line. So I had no idea what else was out there. I had no idea what I was even looking for. And yet I couldn't quiet this voice. There's something more, go find it. So I refused treatment, and my doctor tells me I'm going to die, which admittedly is the exact same words that I used to women, thousands of women before that, who refused treatment and or asked me, what will happen if I don't treat my breast cancer? And I told them they would die of their disease. But God is good. So I go on this journey to heal myself. It's a very selfish journey. It has nothing to do with my patients, nothing to do with making the world a better place. This is all about how am I going to live and raise my children. So I find myself in very short order sitting in a lecture hall. This tall, lanky guy walks on the stage, big toothy grin, and he introduces himself as a functional medicine physician. Now, at this point, I'm a doctor for 20 years.
Yeah, did you roll your eyes?
I am still very much my snooty booty self, because that's what they teach you in medical school, that everyone else is great. Anyone outside of our system is crazy, is a nut job, is a quack, is a
I don't
whatever,
know if this was just
right?
on the Canadian MCAT, but there was a question about if a patient comes to you with like some type of functional or naturopathic or supplement diagnosis, alternative care, what do you tell them? And the correct answer at the time was like, this is wrong, don't do it, or
Yeah,
something crazy.
yeah,
Like, yeah, it's the,
yeah.
yeah.
Because
So,
in the conventional medical world, they confuse I don't know with no. And that's happening all day, every day, right? So here I am with my conventional medical hat, although I'm sick as shit. And so the first thing that comes to my mind is like, there's no such thing as functional medicine. Like, what is this quack talking about? Right. But then I remember that I'm sick and I'm there for a reason. So I check that big fat ego at the door and I tune in. And thank God I did. Because what this man would teach me over the next 2 hours of my life would not only kind of forecast how I was going to heal myself, but it was also telescoping what I was going to do the rest of my life. It also showed me in that day, in that instant, my true life's purpose. Because we are all put on this earth by God with our own unique individual purpose. And I wasn't fulfilling mine because I was meant for so much more than that one-on-one space. I was meant to forever change the conversation around how we diagnose, how we treat, how we reverse, and how we screen for breast cancer. And in that moment, the quack, incidentally, was Dr. Mark Hyman, who in 2016, it is understandable that I had no idea who he was, especially how conventional I was in my training, in my thinking, in my world, right? Like, I didn't know about integrative medicine.
yeah,
I didn't
you
know
were
about
doing your
functional
thing. You were
medicine. I was
performing
just,
your surgeries.
yes,
That's what you were
yes,
doing. You're in your
yes.
world. Yeah.
Yes. So, it's not like in medical school, they're like, hey, there's such a thing as integrative medicine, and you might hear about it, but it's, nonsense. Like, we didn't even get that much. We got like, this is the only way,
Yeah.
right?
I
And,
working with
supplements are bullshit and they just make expensive urine. And that is true in some instances. Like, I'm not going to argue with that. However, we have to marry the two. We have to take the best of both worlds. We can't throw the baby out with bathwater, right? Like, we can't completely abandon conventional medicine, but we also have to respect traditional medicine. And that's what functional medicine is all about. It's about taking the things that we knew to be true for thousands of years that have only recently become inconvenient truths in the conventional medical world, right? Like, don't teach people how to reverse their disease because we've got a drug for that,
Yeah.
right?
Definitely, it's
So,
not profitable. It's
yeah.
definitely not
So
profitable.
instead, let's just create a narrative where we tell people that they can't help themselves, that they can't reverse disease, that they can't be in charge of their health. And instead, we will paternalistically take over. We will ask them not to think. We will ask them not to participate except to the extent where they take a drug or they do a procedure or that kind of thing. And this has been the pervasive narrative for the last 50, 60, 70 years, right?
Yeah,
Like,
and we give all of our power and all of our agency
that's
over
exactly right.
to conventionally trained physicians when you hear the C word. And
Yes.
I'm in a little different of a world where I'm the non-conventionally trained doctor.
Yes.
And I tried for about 10 years, well, as a student, but also maybe the first 4 or 5 years in treating patients myself. And there's a special cancer residency that I did, and our supervisor would have us make a table, like whatever cancer the patient, like a summary table with PubMed, like researched articles attached to it, and a summary table. Cause it's like, these people are busy. They don't have time to look this stuff up themselves. They're going to tell the patient that it just doesn't work. They're going to tell the patient that there is no research. So you're going to hand it to them. You're going to give it to the patient to give to the oncologist or fax to the oncologist's office, whatever, do both,
Yeah. Yeah.
with a summary table of this is the intervention, this is the expected benefit, here's the articles supporting my decision. Because what we would always get told is, Stop it. Antioxidant during radiation, stop. That, like,
Yeah.
oh, your turmeric it's a blood thinner, but stop. Like, they
Yeah.
just get told to do nothing
Yeah.
without even looking to see that there are some synergistic benefits of natural and alternative therapies, even with
Especially, like,
chemotherapeutics.
I love that you brought up turmeric. Turmeric is a great example of something that the medical oncologist, the radiation oncologist don't understand it, don't
Nope.
know what it is and what it does,
And it's
and
so
just
powerful.
say no,
Yeah.
even though we know from research clinical data that it is a chemosensitizer. And at the same time, so it makes the chemotherapy more effective. It protects normal cells and it does the same thing for radiation. So it is absolutely something that should be included in
In
those
part of the
treatment
treatment,
protocols.
for sure.
And instead,
They get
people are
told no.
told no.
So my patients would go, and I'd go over it with them, and I'd show it to them, and they'd see it. And I mean, they don't have research methods training. They don't really know what they're looking at when they're looking at a PubMed article, but they would feel confident and hopeful, and like you'd see the light come back in their eyes. Because it's scary, right, when you get a diagnosis.
Horrible.
So, but it would be met with no.
Yeah. So
I
I'm
had
curious as
clients that would
what was your
even
success rate?
none, like none. Locally, I think one oncologist, one radiologist
one radiation
were
oncologist.
were yeah, were on like came over to my side or were like, "Wait a second, you're on to something here." Everyone else, no, and it was almost egregious because sometimes they'd take this, right? And and I wasn't charging my patients to do this research and put this stuff together. This was like on my own time to try and help bridge this gap, to try and help fix the system that was so clearly broken. And the oncologist or surgeon, or they'd look at it, like just glance at it and throw it in the trash right in front of my patient.
Mhm.
So,
So they're
and you know what? I
totally,
stopped.
totally uncomfortable with not knowing. And so they confuse I don't know with no all the time. And also, they're uncomfortable with your patient getting better and them not having anything to do with it. And
And
I think
that
that,
is
yeah,
the scariest part. And there's people in the functional medicine world, naturopathic medicine world, that I would say are inflicted by the same ego disease. But if I have a patient and they have something that could make them better and there's less side effect, not that there's really side effect to what I do, but you know what I mean? If there's an alternative therapy that can help the patient heal, why not? And I'm
yeah,
not talking about, influencer stuff or like this, right? Because that's the
no,
other
of
thing.
course,
Cancer patients are so vulnerable to their algorithms and buying crap that is not going to work or is not third party tested and all this stuff. So, okay, this is a massive rabbit hole. We could talk for hours about this.
yeah, yeah.
So,
But I think that, the point that you're making is so well elucidated in Kelly Turner's books, Radical Remission and Radical Hope. I don't know. Did you read those books?
yeah, I did. And I would recommend
Yeah.
to my
So
patients.
they're amazing. So anyone with any cancer diagnosis needs to stop right now and do nothing before they read Radical Remission and Radical Hope by Kelly Turner, because she talks about those things that people who have undergone a radical remission.
I know, don't you love how it's radical
Yeah.
remission or
Yeah.
this like reversal of diagnosis, like
Yeah.
as if it's magic and
Yeah. Yeah. But all of these things that these people have in common, because there are common threads, there are commonalities. But I think the most interesting thing was that when she went to the medical oncologist and she said, I want to interview your people who have undergone these remissions, these stage 4 remissions. And the medical oncologists are like, oh, no, they don't exist. And then she went out and found thousands and
Mhm.
thousands of people in which this truly does exist. And she goes back to the same medical oncologist and she says, no, all these people exist. Like, I want to know what you think is happening. He's like, we don't talk about them. And I don't want to talk to them because I don't want to give false hope. Because if all you do is follow that conventional medical paradigm, then yeah, it is false hope. Because cancer is not a surgery deficiency. It's not a chemotherapy deficiency. It's not a radiation deficiency in the area of breast cancer. It's not a tamoxifen deficiency. It's not an aromatase inhibitor deficiency. And if that's all they offer and that's all they get from their medical oncologist, then guess what? They're right. There aren't going to be radical remissions because the radical remissions come from all the things you do, because no one can make you healthy but you, right? And it's about what you eat and what you drink and how you think and how you move and how you sleep and what you put in, on, and around you. I mean, this is what drives health. And the whole purpose, as you and I very well know, is when you drive health, when you create health, disease goes away. And we are brilliant, brilliant machines created by God to be perfect.
the
And
body, I have this conversation daily. Our
yeah,
bodies want to be healthy.
they do. They
We
do.
just need to get rid of the blocks or
Yes.
give it the tools that it needs because they want to be healthy. They want
We
to heal.
need we need to figure out what we need that we don't have, or what we have that we don't need. And when we do that, we are rewarded with health because our bodies were meant to be healthy. We were not built to be unhealthy. We were not built to be dysfunctional.
I
So,
completely agree. So in your profession, I'm interested in your opinion on what causes breast cancer.
yeah. So it's a valid question. There is obviously not one thing that causes breast cancer. Breast cancer is without question multifactorial, and these are things that you are exposed to over and over through the course of your life. And when you are exposed to these things over and over again, like everyone has their ability to tolerate toxins, right? That is the main difference of who gets breast cancer and who does not, because we are all born with a finite ability to tolerate toxins. Now, the toxins are all different things, but once you fill your bucket, that's pretty much when disease and dysfunction starts to develop. And some people, when your bucket gets full, you get breast cancer. And some people, when your bucket gets full, you have cardiac disease. And some people have MS. And some people have neurodegenerative disease, right? It's all a reflection of our exceeding our toxic load, and everyone expresses that excess differently. And in the case of breast cancer, like if you don't get to that root cause, then what is stopping the breast cancer from recurring? What is stopping the next manifestation of the disease, like heart disease? So, when I think about causes of breast cancer, I think about things like processed food, chronic inflammation from the diet, right? So, the standard American diet, as we call it, which for most people is a diet of a lot of processed food. And our bodies really only understand real food, right? If it grew in the ground, fell from a tree, walked, swam, or flew, that is what our body understands as food. And we are feeding our bodies a lot of things that don't meet those criteria. Now, unfortunately, today, it's even more complicated than that because we're not treating our livestock well, we're not treating our oceans well, and we're farming animals and farming fish in a way that is not healthy. So even if you
Yeah,
are on a whole food diet,
the quality of the whole food is
yes.
an issue.
Yes. Yes, we have a quality issue across the board. We have a quality issue with our livestock. We have a quality issue with our plants. We have a quality issue without question. But you don't have to be perfect, and you do the best you can. But processed foods are a problem. Other problems are like sedentary lifestyle on one side of things, because sitting is the new smoking, but then over exercise on the other side of things, because over exercise is equivalent to running from a saber-tooth tiger. Your body really only understands two states. It understands safety and it understands danger. So if you are constantly running away from a saber-tooth tiger because you are over exercising, your body thinks you're in danger all the time, and it goes into physiologic states that put you at risk for breast cancer. And then I
And
think about,
to those listening, we are that group, the overdoers, the in
yeah,
the physiologic state of stress
yes,
all the time.
yes,
And it does. And that's what I love that they're hearing you say this, because I say it all the time, but different perspective, different training, right? I- It's costing us, right? It's
with
costing us to live in this state of chronic stress and
yes,
chronic inflammation.
yes,
And
in
when I say
so
to
many
them,
ways,
I
in so
like
many ways.
it's going to give you breast cancer. It's like this it doesn't we just think we can
And
keep
thyroid
putting one.
dysfunction and cognitive dysfunction and blood sugar abnormalities, and it's going to affect your metabolic health. It's going to affect your cardiovascular health. It's going to affect your overall hormonal health. So it is for sure costing you. And those overachievers, year after year after year after year, it's just building up and the body is keeping score. And it's going to manifest into some form of disease without question. Will it be breast cancer?
Yeah,
Maybe.
maybe not. Yeah,
Maybe
or
not. Maybe it'll be cardiovascular disease.
and it
Maybe,
sounds extremist for me to say it, but it's like it's the truth. I've seen
it's
it
100.
clinically for the last 11 years of women that, their body does eventually say no, like this enough's
Yeah.
enough. We need to rest. And it's interesting when they're coming to me before a diagnosis, but it's the cognitive dysfunction because they can't perform at the level that they of excellence that they expect of themselves at work,
Yeah.
or
Or they're
the
struggling
hormone or
with
the
fertility,
yes,
right?
fertility is big, weight is another big one, but it's all of these dysfunction, but those are the warning lights for me
Yes.
that it's going to lead to chronic disease
Yeah.
down the road, or the number of patients that I have with autoimmune disease. So really interesting. Oh, and on the topic of hormones, does estrogen cause breast cancer? Because this is a big, big one. I know you probably answer these all the time, but they need to
No,
hear
I
it
mean,
from you and not just me.
I'm happy to answer it, and I think it's so important that I answer it over and over and over again because we have to get rid of that crazy, insane narrative that estrogen causes breast cancer. First, I do want to say that breast cancer, even though we've created this narrative that it's a disease of hormone excess, breast cancer is a disease of hormone deficiency, which is why we see the preponderance of breast cancer in the postmenopausal population. Because when the hormones go away, that's when the cells start to struggle. That's when they go into survivor mode because their normal signaling is absent and they're just looking to survive. Breast cancer is a normal response to an abnormal environment. And one of the biggest environmental abnormalities in menopause is a lack of estrogen. So, if you believe that estrogen causes breast cancer, you at the same time have to believe that God put us on this earth for the purposes of developing breast cancer, right? Estrogen is the dominant hormone in women, it is the hormone of life. And without estrogen, when our estrogen wanes, this is when all of the dysfunction happens in our body. We have a rapid deterioration of our bone health, of our heart health, of our brain health, of our joint health, of our bladder health, our vaginal health, our psychological health, everything. We have rapid deterioration after our ovaries shut down and estrogen wanes. And estrogen is actually the last hormone that we lose. We lose progesterone first, and then we lose estrogen. Actually, I'm not telling you the truth there because we lose progesterone first, and then we lose estrogen, and then we lose testosterone. But it's really the most profound changes that we see are from a loss of estrogen. So, with estrogen, we're the problem. Why don't we see breast cancer during the estrogen rich times of our life, during our teens and 20s, during pregnancy, where our estrogen levels are 10 times what they are the rest of our lives? But we just don't see it. We don't see it because breast cancer is not a disease of estrogen excess. It's a disease of estrogen deficiency. And part of the reason that we're seeing more and more breast cancer at younger and younger ages isn't because we have more estrogen, it's because we have less. It's because the environment is such that we have less hormone production earlier on. Our organs, our ovaries, are failing earlier. And they're failing because we are just submerged in a sea of environmental toxins. Now, are xenoestrogens part of the problem? Those environmental estrogens that are acting on the estrogen receptor in a really toxic way? Yes, for sure. But the estrogen that our body makes, that endogenous estrogen, the stuff that is coming from our ovaries, that is not causing breast cancer. And blocking that is just leading to more disease and more dysfunction.
I think I agree with everything and I love everything you just said. And I see in practice, my patients are a lot less scared of estrogen and hormone replacement therapy now, today. And I think we do have social media to thank for that. But 10 years ago, my patients were scared to death
Yes, of
of
course.
estrogen replacement,
The Women's
hormone
Health
replacement, because
Initiative.
the WHI, yeah.
Yeah, the Women's Health
Scared.
Initiative scared everyone to death, very much intentionally. Because if you take away hormone replacement, and listen, that was even garbage hormone replacement. That wasn't even bioidentical hormone replacement. They use conjugated equine estrogen, which is from pregnant horse urine, right? So that estrogen that they used in that study was not the estrogen that we have naturally circulating in our body. That had 30 different variants of estrogen that our body doesn't know
Doesn't
and
make.
it's not and doesn't make and is not accustomed to. And yet we still saw a 23% reduction in breast cancer in women who took that. Now, there was very, very intentional messaging coming out of the Women's Health Initiative, because if you take away a woman's hormones, you create a physiological state that needs a lot of support. And so it became like, you remember the Apple commercial, like, we have an app for that?
Yes.
It became, we have a drug for that, right? So if you're depressed, great. We'll put you on SSRIs. Can't sleep? Great. We have sleeping meds for you. Are you anxious? Great. We'll put you on anxiolytics. Do you have palpitations? Okay, we'll put you on beta blockers. Have your lipids become crazy off the chart? Great. We'll put you on statins. Do you have reflux? You're having problems with digestion now? Great. We'll put you on proton pump inhibitors. Do all the bones and joints in your body ache? Okay, great. We'll put you on nonsteroidal anti-inflammatories. Are you losing your bone density? Great. We'll put you on bisphosphonates. Are you having trouble holding your urine? Okay, we'll give you medicine for that. Sex is unwanted and painful. Okay, well, we're going to put you on something for depression, and then we'll give you lots of.
And have a glass of wine and take a bath. Yeah, it's just one big gaslight. And that was the part during my pre-med degree that I could not reconcile. It didn't add
You
up.
should not reconcile it.
It didn't compute. And I had this entire crisis of, oh my goodness, I was going to be a physician. Like, what do I do with my life? This doesn't work. We're not helping people.
We're not.
We did a class called Health of Canadian Society, and I was looking around at my friends and I'm like, we're going to be part of the problem here. Like, and they're all doctors to this day. They'll text me and ask me questions though. Like,
Yeah.
we've got to, you know what I mean? They don't look at me as a quack necessarily.
Well, thank God for that. And I do think things are changing. They're not changing quickly enough for my liking, but they are changing. And, there are many people who, 10 years ago when I was a surgeon and running the cancer program for my hospital, and I was, one of the smartest people in the room. And then I left and went into integrative oncology and functional medicine. And suddenly, like, I was an idiot and a quack and all of that.
Yeah.
And now it's coming back around again where my
They
colleague
want your info.
at
They're like,
Penn, when I
hey.
was, yeah. So,
Yeah.
now people go to Penn and they're getting treated for breast cancer, and the patients ask those same colleagues, what would you do if you were me? And they will say, like, well, here's your protocol. and I would call Dr. Jenn Simmons, like on the down low, on the sly. That's what I
Right.
was saying if it were
And
me,
isn't it
right?
so insane to me that that's still, but they're making the connection,
Well,
whereas it
it's
wouldn't
just
have happened.
it's undeniable that when someone like us, when we're involved in the treatment paradigm, people do better. And the medical oncologists see that,
Yeah.
right?
Even
They
side
see that.
effects during treatment are
Of course.
less.
Of course,
And
because
that's what I thought. I was like, if at the very least I can help this patient get through treatment
yes,
and like sleep and not shit themselves as much and
eh,
right? Like and
but
be able to
or at
eat.
all, right?
Yeah.
Like you help them sleep and they maintain their energy because they're
And their
moving
white blood
and
cells stay
and
up so
and their
they can
white blood
get
cells
their treatment.
and they don't need factors. They don't need growth factors, which one of the most miserable parts of chemotherapy is having to take white blood cell support. But
Mhm.
if it turns out that if you fast through treatment, you don't need the white blood cell support and you avoid taking steroids. So the steroids through treatment are a huge issue. And they're given so that you're not nauseous and so you don't have these allergic reactions during treatment. But if you fast, you also don't have the nausea. You also don't have the allergic reactions and you're able to maintain your white blood cell count. So there's so many advantages to fasting, and yet this is not being universally discussed. And unless they're seeing someone like me, patients don't know how to do it.
Definitely not. So while we have you here, I have two questions. What would you recommend for breast cancer screening?
Hmm.
Because I know a lot of the listeners, I have a lot of survivors as listeners, but a lot that would want to be preventative. So,
Yeah.
because there's some interesting stuff with screening too. I have my opinions, but let's hear yours.
Yeah. So let's talk about why the way that we have been screening for the last 50 years doesn't work, right? Because what the entire screening program is based on is mammogram. A mammogram is a terrible, archaic test that doesn't work, that doesn't even do what it, it was, what it set out to do, right? Because when the mammographic screening program was rolled out in the United States in the 1970s, first of all, it was built on this foundational understanding that breast cancer growth is both linear and predictable. And what that means is that a breast cancer starts at some small size and it progresses in a linear fashion so that it will ultimately reach some critical size that if you found it before it reached that critical size, it would not go on to metastasize and you could save lives and save breasts and have people get less treatment. And it's a lovely, lovely theory. Just doesn't happen to be true. Breast cancer is all about biology. It is what it is from the very beginning. And there are some breast cancers that will never go on to become anything at all. They won't even progress to the point at which they are clinically detectable. And there are some breast cancers that, from the very start, they are aggressive processes. And no matter what you do and when you find them, they're going to go on and be aggressive processes. And then there's everything in between, right? And whether or not you get a mammogram doesn't impact that. So there are huge clinical trials, huge. I'm talking about 600,000 women, the Swedish trial, where they looked at 300,000 got screened with mammogram, 300,000 just had physical examination. It's universal health care like Canada. So everyone has the same access to care. Everyone gets the same exact care. So that part of it is controlled. And they followed these women out over, I don't even remember how many years, but a lot. And what they found is that the exact same number of women died of breast cancer in each group. And the only difference between them is that if you use mammogram to screen for breast cancer as opposed to physical examination, you're going to diagnose 20 to 30% more breast cancers, which means that we are over-diagnosing breast cancer by
And
20 to
over-treating.
and over-treating, right? And over-treating is a big deal because we cause a lot of dysfunction and death
Yeah.
by
There's a
over
lot of harm with overtreatment.
a lot of
And
harm.
I wrote a paper on breast cancer screening in the third year of my pre-med degree. And I remember going to my professor and being like, this doesn't work. Like, this is scary. What are we doing? So
What are
what
we
do you
doing?
recommend instead?
Yeah. Well, I do want to bring up one more study because I think it's germane to this conversation. And that's that I think that there was a belief that maybe screening with mammogram doesn't help everyone, but it can help young women, right? So there is actually a young woman study. It's the Canadian Breast Cancer Screening Study. And it was 90,000 women aged 40 to 59. And they did the same thing, 45,000 in the screening with mammogram group, 45,000 in the screening with physical exam group. Again, because it's universal health care, everyone has the same access to care and gets the same care. And they found the exact same thing, that the same number of women die of breast cancer in each group. And in the group where you're screening with mammogram, you have 25% more cancers, right? So we are.
And is it because I don't know if I've actually looked at that exact study, but younger women have denser breasts, like more fibrocystic breasts, and it makes mammogram even less accurate. Is that true or not?
It definitely makes mammogram less accurate. The other thing it does, which most people don't understand, is that people think that when you get a mammogram, there is a measured, consistent dose of radiation that is given to the breast. It's absolutely not true. That the amount of radiation that is delivered during a mammogram is completely dependent on the size of the breast and the density of the breast. Because the bigger the breast is, or the denser the breast is, the more radiation that is needed in order to penetrate those tissues and create the image. So dense breasted women are actually getting more radiation. Large breasted women are actually getting more radiation. And we know that radiation has a linear relationship with the development of breast cancer. It is a known carcinogen. So, as it turns out, the more mammograms you get in your lifetime, the higher your risk is of getting breast cancer. So, one surefire way to get breast cancer is to continue to get your mammogram every year.
Ay,
That will guarantee
isn't
your
it? It's
life.
so backwards. It's so backwards.
Thank
What do you recommend for
Yeah.
screening?
So, I recommend a 3-part screening program. So the first is that I think that everyone needs to be doing their breast examination, a self breast
Self
examination.
breast exam, yeah.
Every single woman thinks her breasts are lumpy. It's okay. Just own your lumps. Know what your breasts feel like when they're normal so that you can know what they feel like when something's changed, right? So that's the first
Hence
part.
my screening, my own personal screening that I did a couple months ago because I didn't like the way something felt.
Yeah. But that's okay. It's okay to be intuitive. It's okay to know what your body feels like. No one is ever going to know you better than you know yourself. And like we are kidding ourselves if we think we're going to our doctor every year and our doctor is doing our examination and our doctor is able to say whether or not like that is normal
Yeah,
for you.
normal tissue or
Like
where you are
how
in
does
your
your doctor
cycle.
remember
They have
what
no
your breasts
idea.
feel like
No.
every year, right? So I think it's really important for everyone to examine their breasts. If you're premenopausal, you're doing it day 7 of your cycle. If you're postmenopausal, you can do it at any time. So feel them on the first, whatever you want to do. The second part of what I do for screening is called the ARIA Tears test. I just happen to be using that brand. This technology is so brilliant and so easy to copy that there's going to be lots and lots of vendors for this test. But right now I'm using ARIA. So what it is, it's the ARIA Tears test where you're taking a sample of your eye fluid. You don't have to make yourself cry or poke yourself in the eye or anything like that. It's a small, tiny piece of paper which you put inside of your lid, close your eye for 5 minutes, take the paper out, send it back to the company, and you get a result in a week and a half. What it's measuring are two proteins that are abundant in your tears, the S100A8 and S100A9 proteins. And when these proteins reach a critical mass, a critical number, they are highly associated with the early stages of breast cancer. So if you have a normal ARIA test, and this is, again, an at-home kit that you do, if you have a normal ARIA test, the likelihood that you have breast cancer is very, very low. And in my opinion, you're done. You don't even need imaging. And I think that in the future, it's going to be tests like this that will determine who does and who does not need imaging, because I don't think everyone needs imaging.
No, that's what, yeah.
I know everyone wants imaging because
Oh,
we've
because
been
they have that,
so
yeah, sense of
conditioned.
security. Yeah,
Yes.
that
But
which
I
we
don't
talked
think
about as kind
everyone
of a
needs
false
imaging.
sense of security.
Yes. Yes. Well, that's another major problem with mammogram is that it will miss 40% of cancers in 40% of the population, which are the dense breasted population. So people go for their mammogram and they're lulled into this false sense of security, and they kind of like take their foot off the gas and think that they're fine and that they have nothing to worry about. And then lo and behold, like 3 months later, they feel a lump in their breast. And this happens all the time. This is not unusual because mammogram is a terrible, terrible test. So, in any event, the ARIA test, if you have a clinically significant result, this means in real time, you have a real risk of breast cancer. So, all of those people I tell to go get imaging. Now, it has a specificity of 58%, which means that 58% of the time, if you don't have breast cancer, this test will be normal. And 42% of the time, you don't currently have breast cancer, but this test is going to be positive. But I want to be clear, there are no false positives for this test. If you have these inflammatory markers, you are at risk for breast cancer. And do you know what that is? It's opportunity. This is your opportunity to prevent a diagnosis. And there's nothing else out there right now that can do this, that can risk stratify you like this and can help inspire you to make
To
the
make
necessary
changes.
changes
Yeah.
so that you don't have to get a diagnosis. This can actually prevent a diagnosis. And so what I recommend for people who have a clinically positive test, yes, go have imaging. And then read my book, The Smart Woman's Guide to Breast Cancer. It's all about prevention and the things that you need to do in order to prevent a breast cancer diagnosis or recurrence if you already have one. And I have a breast cancer prevention course. And so you can enroll in that course and there learn about your genetics, learn how your body functions, learn what you should eat, when you should eat, how you should move, support your sleep, support your detoxification, what supplements you need so you don't have a supplement graveyard, which I know everyone has
Yeah.
because it's
Even me.
impossible to know. Yeah, everyone does. Everyone does. Because unless you know your genetics, unless you know exactly what your body needs and what it doesn't, you're going to have a supplement graveyard. Because you're going to hear about the latest, greatest supplement. You're going to order it. And I need everyone to know, first of all, there's no one thing. In the breast cancer population, in the not breast cancer population, there is no one thing. There's no magic.
Wouldn't it be lovely if there was? But
Yes, it
there
would
is
be
not.
lovely if there was. So now let's talk about imaging. So I own 2 imaging centers. They're called Perfection Imaging. I'm putting another 48 up. I'll have a total of 50. That is my life's goal. That's what I've put out there to the universe, and that's what I will do. There, we are using something called QT imaging, a technology called QT imaging. It is not my technology. I did not invent it.
Hmm.
T uses sound waves transmitted through a warm water bath that creates a true 3D reconstruction of the breast. So it collects 200,000 times more data points than MRI without pain, without compression, without radiation,
Mm.
without contrast medium. So in a 100% safe and comfortable way, you can screen for breast cancer accurately, reliably, affordably, all of it. I know that this technology will forever change how we screen for breast cancer. And notice I do not rely on imaging alone. I use imaging in the context of physical examination and
Family history.
a
Yeah.
true physiologic test, right?
Yeah.
The ARIA tears test is a true physiologic measure of what your risks are right now. And then if you don't have access to QT, if you're not near one of my perfection imaging centers or the other centers that exist around the US, then I think that ultrasound suffices. I don't think that mammogram offers anything beyond what ultrasound can offer right now. Now, ultrasound does not compare to QT technology. It's a very low resolution technology. It will still lead to a lot of false positives. It will still lead to a lot of unnecessary biopsies, but it is safe and better than being radiated. Now, I do not advocate for screening mammogram, as I'm sure you heard loud and clear. I am also not saying that you will never have another mammogram again in your lifetime, because if you have an abnormal QT scan, if you have something found on ultrasound, which is suspicious, if you have something found on physical examination and confirmed on ultrasound and it's suspicious, you're going to have to speak the language of the providers. And the only language they speak right
Is
now
mammogram. Yeah.
is mammogram. So there are ways to protect yourself. I have a radiation protection protocol, which people can use prior to getting any radiation emitting scan. However, you may need a mammogram. And for diagnostic purposes, that's okay. What I'm not okay with is taking the normal, healthy population. This is the screening population, right? This is the population of women who have no reason to believe that they have breast cancer. I have a huge problem subjecting them, exposing them to radiation. It's unethical. We should not and cannot be doing it. But you may need another mammogram in your life, just like you may need a CAT scan or you may need some other study. And if there is a benefit to doing that study, I get it. But there is absolutely zero benefit to you getting a screening mammogram.
I'm so happy to hear you say this. The third year pre-med me is cheering. Okay, last question, because I know this is on everyone's mind, and I'm a big proponent of hormone replacement therapy. I prescribe hormone replacement therapy.
And it's also why everyone has me on their podcast. They want to hear it from the source.
Is hormone replacement therapy safe after breast cancer?
Yeah. So you are exactly right. It's the question on everyone's mind. There has been a very tightly controlled narrative that sounds like estrogen causes breast cancer, so that if you have breast cancer, especially a hormone positive breast cancer, we need to take away all of your estrogen and you can never have hormone replacement. And that narrative is there very intentionally because they want to sell you drugs. And those drugs lead to a lot of dysfunction, which leads to a lot more drugs and a lot more procedures. And it's a very, very intentional narrative. And because the person that gives you those drugs doesn't take care of the things down the line, they don't think about them or worry about them. Right? So the medical oncologist that's giving you the aromatase inhibitor, which is preventing you from making estrogen, he's not dealing with you when you have a heart attack or a stroke. He's not dealing with you when you have a pathologic fracture because you've developed such bad osteoporosis.
Yeah,
He's
how
not dealing with
siloed
you
the
you have
specialties
dementia and
are.
Alzheimer's, right? He's not dealing with you when you're in adult diapers because you can't hold your urine. He's not dealing with you as you're going through your divorce because your relationship was ruined over the state that you were left in from breast cancer treatment, right? So this is part of The problem is that we have become so siloed. So we're allowing for these oversimplified, reductive thinking. We're allowing for that to exist because why would the medical oncologist look past that thinking? They don't need to. All they need to think about is, I have this drug that I have to give you for 5 years. What happens to you after that 5 years is not my problem.
Yeah, it's like
And
it stops, my work stops here.
yes, my work stops here. Now, listen, it's not that they're not empathetic. It's not that they're not good people. It's not that they're not good doctors. They are all of those things. It's not that they're not caring, and it's not that they're not well-intentioned. They are all of those things. They are caring. They are well-intentioned. They are good doctors. They're doing exactly what they were trained to do. The problem, like, don't hate the player, hate the game.
Yeah, they're working within a broken system.
Yes. Yes,
But
exactly.
why more of them are not asking questions like you and I is a little,
Because they're not dealing with that part of the person.
yeah.
And so, in any event, the answer to your question is there have been 30 studies on breast cancer patients with hormone positive disease taking hormone replacement. Half of the studies are bioidentical hormone replacement, half of the studies are non bioidentical hormone replacement, and all the studies found the same thing. There's no increased risk of recurrence. There is no increased risk of death from breast cancer. There is less, not more, less all-cause mortality, as we would expect, because hormones prevent cardiovascular disease, prevent neurodegenerative disease, prevent osteoporosis.
And that's a thing for me because we get so myopic, right? Once there is a cancer diagnosis, and that's the focus. And then they're forgetting about the whole body and anything that prevents all cause mortality. Like, we need to listen. We need to
Yes.
take it seriously
Yes.
because it's not just cancer.
No, of course not. And what most people don't realize is most women who get breast cancer, they don't die of breast cancer. They die of cardiovascular disease. And that is because, first of all, cardiovascular disease is the number one threat to a woman's life exponentially from the time that she's 30 on. And if you are treated for breast cancer, you are 2 to 3 times more likely to get cardiovascular disease because all of the treatments for breast cancer accelerate cardiovascular disease. So if you take a woman with breast cancer, treat her for breast cancer, but then put her on hormone replacement afterwards, you are protecting her against cardiovascular disease without increasing her risk of a breast cancer recurrence. So you're actually creating a healthier person afterwards. And that is especially meaningful. And it is for so many reasons, not the least of which, when you are suffering, it is really hard to be healthy. It is near impossible to heal when you are in pain. It is near impossible to be healthy when you are suffering. And we are leaving women suffering after breast cancer, really suffering. We have 4 million breast cancer survivors in the United States. And we tell these women that they should be grateful to be alive, and they are grateful. But it is hard to feel grateful when you can't think, you can't remember your words, you're depressed, you're scared,
Your
you're anxious,
relationship's fallen apart.
your relationship is falling apart or absent, you're in pain, you've gained weight, your breasts are deformed or absent, you're leaking urine, sex is unwanted and painful. Like, it's really hard to feel grateful when all of that stuff is going on. And yet, this is how we're leaving most women after breast cancer. And they have been, you mentioned that social media has done a really good job of bringing this postmenopausal conversation to light and and making hormones more acceptable, right? After 20 years of being unacceptable, right?
Yes.
And so But the breast cancer population is still left out of that conversation. This is truly the forgotten woman. And that's the title of my next book, which will be out in 2027 if I start writing really soon.
I know I've
But
got my book number 2
yeah,
in the works too.
but I mean, it's happening. It's definitely happening. I just don't have enough time to breathe, let alone write. But that book is coming. And just know that, this has been the truly forgotten woman, the truly forgotten population. And one of the soapboxes that I stand on is I'm going to make sure that these women get access to hormones because they're people too. And they deserve to live full, rewarding, connected, beautiful lives like everyone else. They deserve the same access and the same entitlement that everyone else has. And so I am making it my mission to make sure that everyone who wants access to hormone replacement gets access to hormone replacement.
I'm so happy that to have you here, to be having this conversation. And obviously, when the naturopathic doctor says it, it's one thing. But when the conventionally trained doctor says it, I think people just even feel that extra layer
Well,
of
I hope they're
safety.
leaning in. I hope they're leaning in.
They are. They definitely are. So tell everyone where they can find you.
Yeah. So, well, if you want to hear more of me, I have my own podcast. It's called Keeping Abreast with Dr. Jenn, where we release a new episode every week. I did write a book, a best-selling book called The Smart Woman's Guide to Breast Cancer. And that is really for any woman because, yes, it is about education. And yes, it is about understanding breast cancer, but it's also about prevention because ultimately, if you've had breast cancer, you want to prevent a recurrence. And if you haven't had breast cancer, you want to learn how to not get one. So that's my book, The Smart Woman's Guide to Breast Cancer. And then my medical practice is called Real Health MD, where we're helping to prevent breast cancer, but we're also helping women through a diagnosis at any stage. So recently diagnosed, currently in treatment, finished treatment and wondering now what, or living with metastatic disease. Any of those people, we are there to help you navigate your life towards amazing health. And then I also have a breast cancer prevention program where we we help women to prevent ever getting a breast cancer diagnosis. And most of the people are coming in that program because they've had a positive ARIA test. They've had a clinically significant ARIA test, and they don't want to get a breast cancer diagnosis. Then you can find me on all the social channels at Dr. Jenn Simmons, and my Jen has 2 N's. And if you are looking for that scan that I talked about, because people are conditioned and want imaging, I totally get it. But if you're going to have imaging, let it be 100% safe and painless. So perfectionimaging.com, and perfection is spelled with a QT in the middle.
Thank you. And we will link all of that in the show notes for everyone listening. Dr. Jenn, thank you so much.
It was my pleasure to be here with you.